Hi, my name's Nick, and you can see here that I've put myself, Ben, and Rick down as we have been involved in creating some real-time dashboards. And one of the dashboards that we've created is an antimicrobial dashboard. So Rick and I are pharmacists that specialise in electronic prescribing, and Ben is our pharmacy data analyst, although I'm not sure that title does him justice. And we are from University Hospitals Bristol. So we are one of the 16 GDE sites, the acute trusts, and we work with a company called System C, who are a software developer. Back in October, we took their first-of-kind electronic prescribing system live on one of our wards. We're now on 4 wards, and quite quickly we realised that there were some benefits that we could get out of the business intelligence area, so the reporting software that we had. We started talking to System C and very quickly started to realise that if you ask a software developer to do anything for us, it will take 2, 3, 4 years. We then said, right, well, who else can we ask? Because we work in a little bit in IT, we started asking a few questions by some of the guys that did some of the finance reporting, and very quickly realised that they hate finance reporting. Anything that they can do to distract them from that. So we started talking to them a little bit about our clinical dashboards and actually showing them that we could start doing some quite exciting things clinically with this information. And then we started to get wise to the fact that we had Ben in our team. We said to Ben, would you be interested in maybe learning a little bit of coding and kind of helping to be a little bit of a bridge between the IT guys and us? And he has taken that opportunity and massively developed to the point that we now do all of the coding within pharmacy for these dashboards, and Ben does it all. Which massively speeds things up. Rather than us going to a software developer and saying, can you change this line to bold, and it takes them 6 months, it takes Ben 30 minutes. So this is our anti-infectives dashboard. So we started off with the dashboard idea as within pharmacy, it's kind of a prioritization tool to just show us where the people that we needed to go and see were. And this grew from there, really. So the anti-infectives dashboard, in essence, shows you all of the antibiotics that are prescribed within the EPMA live wards. So hopefully, within the next year, we'll show you all the antibiotics within the trust. And again, this started out as kind of a prioritization tool to say to our antimicrobial team, who traditionally used to go to wards one after the next and pick up every drug chart and see whether or not there was an antibiotic prescribed, which is a huge waste of time. Now we can say, these are all your patients. You can see here that this is the prescription that they're on, the route. You can see the indication. You can see whether or not the review date's passed. You can see any abnormal results. And we started with this, and then we started to say, well, actually, one of the other complaints that we've got is that we have a system for our blood results, we have a system for our microbiology results, we have a system for our EOBS, we have a system for our electronic prescribing, and we had all of these different places that you needed to look. So actually these dashboards have started to become more of bring all of that information together, and you can actually start seeing a picture of your patient that you used to be able to see when you used to pick up the end of bed folder. So you can start seeing that these dashboards start having 2 real areas of use. So you can see here, you can pull all of the information off. You can see the historic data. You can see what antibiotics are prescribed. We can see compliance data. You can see in the top left-hand corner, there's a link to another dashboard which shows you all of our compliance data, which is all live. This updates every few minutes. And you can then see on the right hand side we also added cultures quite recently, and if you hover over the cultures it gives you the result as a tip tool. So it means that you're not having to go to lots of different systems to see what you actually need to see. So our impact, we are still on 4 wards, and we have several more wards to go. Hopefully in the next year we will get out to all of those wards, and that's when we'll really start seeing the impact. The anecdotal evidence from our antimicrobial team is that these are amazing. They save them so much time. because they don't have to go and pick every chart up, and they can actually start seeing the patients very quickly that they need to see. They can look at this dashboard, you can filter all of those columns to see the bits of information that you want. You can drill them down, so if you just want to see just all of the co-amoxiclavs in the trust, you can select that very easily, and it'll show you all of those. So when you then start thinking about audit data, what we've really been discussing with them is audit data is great to show you what you did 6 months ago, and were you according to guidelines 6 months ago. But why do we want to know what we did 6 months ago when we can know what we did 30 seconds ago? So actually, why can't we start using this information? And all of this time that you were using to take audits and request notes, why don't you use that time to actually sit in front of this computer and quickly look at something and go, do you know something? These 10 patients, we're doing something wrong. So I will go to those wards and I'll talk to the teams and I'll talk to the patient, and we'll actually fix the problem there and then rather than retrospectively looking at what's happened. So that's it. Thank you very much.